Hello everyone. I am continuing my presentation of Part D, and in this topic I am talking about which drugs are covered. I am in the Medicare and You book, page 78. Please get your book out and let us begin. Which drugs are covered? Information about a plan's list of covered drugs called a formulary isn't included in this handbook because each plan has its own formulary. Many Medicare drug plans place different drugs into different tiers on their formularies. Drugs in each tier have a different cost. Drugs in a lower tier will generally cost less than a drug in a higher tier. In some cases, if your drug is in a higher tier and your prescriber thinks you need that drug instead of a similar drug in a lower tier, you or your prescriber can ask your plan for an exception. See page 92 for more information on exceptions. So, page 79, formularies can be changed by the plan. Your plan will notify you of any formulary changes that affects drugs you're taking. Contact the plan for its current formulary or visit the plan's website. It's very important that you look at their website frequently. You can also visit the Medicare Plan Finder at medicare.gov/plan-compare or call 1-800-MEDICARE. Where it says important in blue, each month that you fill a prescription, your drug plan mails you an explanation of benefits notice. Review your notice and check it for mistakes. Contact your plan if you have questions or find mistakes. If you suspect fraud, call the Medicare Drug Integrity Contractor at 1-877-7-SAFE-RX. The bottom line is, prescription drug plans have formularies and they have everything in categories for you, and you must pay attention to which category your prescription drug is. A generic drug is usually tier 1, and some companies will have what they call preferred generic and then non-preferred generic, and they'll have different costs. But your brand name drugs and your specialty drugs are those what we call tiers. Continuing on, page 79. Plans have these coverage rules for certain drugs. Prior authorization. You and or your prescriber must contact the drug plan before you fill certain prescriptions. Your prescriber may need to show that the drug is medically necessary for the plan to cover it. Plans may also use prior authorization when they cover a medication for certain medical conditions, but not all medical conditions for which a drug is approved. When this occurs, plans will likely have an alternative medications on their formulary for the other medical conditions for which the drug can be prescribed. So it must be authorized. The next one, quantity limits. Limits on how much medication you can get at a time. The next rule is step therapy. In most cases, you must try one or more similar lower cost drugs before the plan will cover the prescribed drugs. So all these insurance companies have that rule where they're going to usually start with the generic name first before they go to the brand name. Next one, prescription safety checks at the pharmacy, including opiate pain medications. Before your prescriptions are filled, your Medicare drug plan and pharmacy perform additional safety checks, like checking for drug interactions and incorrect dosages. These checks also include checking for possible unsafe amounts of opiates, limiting the day's supply of a first prescription for opiates, and use of opiates at the same time as benzodiazepines, commonly used for anxiety and sleep. Opiate pain medications like oxycodone and hydrocodone can help with these certain types of pain, but have serious risks like addiction, overdose, and death. These risks are increased when opiates are taken with certain other medications. Next rule, drug management programs. Some Medicare drug plans have a program in place to help you use these opiates and benzodiazepines safely. If you get opiates from multiple doctors and pharmacies, your plan will contact these doctors who prescribe these drugs to make sure they are medically necessary and that you're using them appropriately. If your Medicare drug plan decides your prescription opiates and benzodiazepines may not be safe, the plan will send you a letter in advance. This letter will tell you if the plan will limit coverage of these drugs for you or if you'll be required to get the prescriptions for these drugs only from a doctor or pharmacy that you select. You and your doctor have the right to appeal these limitations. If you disagree with the plan's decision, see page 90. The letter will also tell you how to contact the plan if you have questions or would like to make an appeal. Page 80. The opiate safety reviews at the pharmacy and drug management programs generally don't apply to you if you have cancer, getting palliative or end-of-life care, are in hospice, or reside in a long-term care facility. If you or your prescriber believe that one of these coverage rules should be waived, you can always ask for an exception. If you are prescribed opiates, 1. Talk with your doctor about your dosage and the length of time you'll be taking them. You and your doctor may decide later if you don't need to take all of your prescription. 2. Talk with your doctor about other options that Medicare approves to treat your pain, like non-opiate medications and devices, physical therapy, individual and group therapy, behavioral health integration services, and more. There also may be other pain treatment options available that Medicare doesn't cover. Never take opiates in greater amounts or more than prescribed. Safely dispose of unused prescription opiates through your community drugs take-back program or your pharmacy mail-back program. For more information on safe and effective pain management and opiate use, visit Medicare.gov or call 1-800-MEDICARE. So as you can see, Medicare takes opiate use very seriously, and they have all these guidelines set for you to make sure that you are safe. Do you get automatic prescription refills in the mail? Some people with Medicare get their prescription drugs by using an automatic refill service that automatically delivers prescription drugs when they're about to run out. To make sure you'll still need a prescription before they send you a refill, prescription drug plans may offer a voluntary auto ship program. Contact your plan for more information. In my case, I get a text message, do you want a refill, yes or no? And I reply, and they get it back to me. Next one, Medication Therapy Management Program, MTM. Plans with Medicare prescription drug coverage must offer additional medication therapy management services to plan members who meet certain requirements. Members who qualify can get these MTM services to help them understand how to manage your medications and, more importantly, use them safely. The MTM services offered may vary in some plans. MTM services are free and usually include a discussion with a pharmacist or healthcare provider to review your medications. The pharmacist or healthcare provider may talk with you about the following: how well your medications are working, whether your medications have side effects, if there might be interactions between the drugs you're taking, whether your costs can be lowered, or other problems you're having. Very important, visit medicare.gov/plan-compare to get general information about program eligibility for your Medicare drug plan or for other plans that interest you. Contact each drug plan for specific details. A few vocabulary words. Formulary, again, is a list of prescription drugs covered by a prescription drug plan or another insurance plan offering prescription drug benefits, also called a drug list. Medically necessary. Healthcare services or supplies needed to diagnose or treat an illness, injury, condition, disease, or its symptoms that meet accepted standards of medicine. This concludes this portion for Part D, which drugs are covered. I hope this helps you understand why insurance carriers ask you for the things you do, because of their rules and their limits that they have on prescription drugs. Thank you so much for your time. Have a beautiful day.